Hi, my name is Darby. I'm going to talk about how to obtain an ECG, which is a representation of the electrical activity of the patient's heart. And some of the materials that you need is the patient's chart, the electrocardiograph, the ECG paper, the electrode, which are these little stickers right here, wipes, the patient gown, a drape, blanket, pillows, gauze pads, alcohol, a moist towel, and scissors for trimming hair if needed. So the first thing you do is to turn on the electrocardiograph and make sure that there's enough paper and that the machine is working properly. The next is to identify the patient, introduce myself, and explain how the ECG is going to work. The next step is to ask the patient to disrobe from the waist up, removing any jewelry or a bra or anything that might get in the way of the electrodes. The next thing is to assist the patient onto the table and put them in the supine position, laying down, unless the patient has trouble laying flat. And then you would put them in the Fowler's position, which would be a pillow under their neck, or and a pillow under their knees for comfort if needed. And then asking the patient to remain still and quiet, and then using the gauze pads to clean the skin, and and then drying it with gauze pads so the electrodes will stick better onto the chest. So I will demonstrate how to apply the electrodes. Okay, so V1 goes to it's the fourth intercostal space between the ribs to the right of the sternum, and which would be about here. And the electrode thing points downwards. And V2 is the fourth intercostal space to the left of the sternum, which is over here. And then V4 is the fifth intercostal space on the left midline of the clavicle, which would be down here. V2. I'm on V4. V4 and mid-clavicular line would be about over here. And then V3 is the fifth intercostal space midway between V2 and V4, which would be about here. And pointing the electrode down, goes this way. Okay, it's kind of hard doing it on my clothes. And then V6 is the fifth intercostal space on the left mid-axillary line, which would be like over here, under the armpit. And then V5 would go in between, midway between V4 and V6 over here. And then you would apply the right arm, which would be here. And then the left arm would be about here. And then depending on the provider, you can apply the electrodes on the legs, or you can apply them here and here, which I will apply one because apparently I'm missing one of the other ones. So it would be here, and the other one would be here. So after you apply all the electrodes, you would stick the wires on each one, and then make sure they're all in the right position, checking for the tracings, and then press the turn the electrocardiograph on and press the record button. And if everything, and then remind the patient to lie quietly, and then run the ECG. And then checking, after you do that, checking the artifacts to make sure that the reading is correct. And then disconnect the patient from the machine, take all the wires off, and remove the electrodes from the patient, and then clean the patient's skin with a moist towel, and then help the patient get up off the table, and assist the patient getting dressed if needed, and then washing the hands, and then recording the patient's information onto their chart, and then throwing the electrodes away, and then clean and disinfect any equipment that was used according to the OSHA guidelines. And that's obtaining an ECG.